Earlier in August, I had my first root canal. Didn't know what to expect, but had pain and swelling after the original root canal. The dentist, through no fault of his own, because the technology wasn't available at that time, couldn't see it because it was hidden, and did the original roots as he saw them. But then, because of my swelling and because of the infection and because of the pain, he took another one and said, "Oh my goodness, here's another one." And so I had like 2 root canals in a couple of weeks. Same tooth, but he went in and found the other hidden root. Then he did the root canal on that. I had continued swelling and pain so much that I could barely open my mouth with my breathing now occluded. I went to an oral surgeon and was rushed into the operating room, and they drained a lot of infection out of my neck. I was having a hard time breathing, and so they life-flighted me. The doctors didn't feel that I would survive in an ambulance, and I spent about a week in the intensive care unit, the shock trauma unit at LDS Hospital. It was very difficult for my family to see me on a breathing machine, and all of which could have been prevented if we were doing it today with the 3D imaging. But the technology that's available today wasn't around. If it had been, it would have saved me a lot of heartache, my family. Hard to believe that all of that came about by a simple root canal that could have been prevented.
So my daughter had some extra baby teeth that were out of place. They were growing the wrong way in her mouth. The dentist decided to take an x-ray. He could see the baby teeth, but in relation to where they were exactly, more towards the nose or towards the palate, he wasn't able to see that. And so he attempted to take out the 2 front teeth and go through the sockets to remove them. And without too much exploration, was unable to find them. So Dr. Viehweg was called in to assess the situation. He suggested that we come in and have some 3D imaging done. I was really impressed with the technology. I had no knowledge of it beforehand, and when I saw the actual image come up on the computer screen and we were able to see exactly where the baby teeth were, I was really impressed. And I was relieved at the same time knowing that right away he'd be able to find the teeth and remove them. And it took about 15 minutes to complete the procedure, and she healed up well. We're really happy with the staff and Dr. Viehweg and the way we were treated. I was relieved to come in and see what he was able to do for us. And I wish that I had known the first surgery could have been avoided. It was sad to see her go through that. Had we known that this technology was available, we would have only had to come in one time and have it done with. But we're still grateful to Dr. Viehweg and his staff.
Situations like these can be avoided now as opposed to in the past because of the technology that we have. Even 10 or 15 years ago, the technology that we're utilizing with regard to cone beam CAT scan technology to render 3D images was unavailable. With the exception of having the patient go to the hospital and undergo a full CT scan of the head and neck, we can take segments of the patient's face and jaws and get 3-dimensional representation using the technology that we have. With that, we can avoid some surgeries that are sometimes termed exploratory surgery. We don't have to do exploratory surgery anymore. We can find out exactly what is entailed with regard to where the pathology lies so that we can know beforehand. This in turn makes our surgery more efficient. It makes us able to do the surgery faster because we know right where the anatomy is before we even touch the patient in the operating room. In addition to plain radiography, which gives us the 2-dimensional representation of the structures that we're studying, our particular apparatus gives us the opportunity to take a focused field 3-dimensional study. This uses the same technology as the CT scanners found in numerous hospitals throughout the country. Without this technology, a patient would be required to go to a hospital to get a CT scan of the head and neck region, or reliance upon conventional 2-dimensional x-rays would be required. As we've seen, relying only on 2-dimensional x-rays sometimes creates problems that could be avoided had we the images provided by a cone beam CT scanner. So if you or a family member needs surgery, insist upon having the best technology available. In our case, with regards to this particular setting, 3D cone beam CT technology is state-of-the-art. If your surgeon doesn't have this technology, ask him to help you find the technology so that you can provide the best care for you or your family members.